Good morning, everyone. Today we're going to talk about a very important and potentially life-threatening condition seen in cancer patients, hyperkalemia, or high potassium levels in the blood. Let's understand what it is, why it happens, how to recognize it early, and what we can do to manage it effectively. 1. Introduction. First, let's recall that potassium, K, is a mineral that helps our muscles and heart work properly. Normally, the blood potassium level is between 3.5 and 5.0 milliequivalent/L. When it rises above 5.0, we call it hyperkalemia. Why is this dangerous? Because too much potassium affects the heart's electrical activity, which can lead to irregular heartbeats, cardiac arrest, or even death if not treated quickly. 2. Why cancer patients are at risk. Cancer patients are particularly prone to hyperkalemia. Let's see why. After chemotherapy or radiation, many cancer cells die rapidly. This is called tumor lysis syndrome, TLS. When tumor cells break down, they release potassium, phosphate, and uric acid into the bloodstream, raising potassium levels quickly. Some patients develop renal, kidney problems, either due to cancer itself, dehydration, or drug toxicity. When kidneys don't work well, potassium can't be excreted. Certain medicines like potassium-sparing diuretics, ACE inhibitors, or blood transfusions can also add to the problem. So, a cancer patient receiving chemotherapy who also has poor kidney function is high risk for hyperkalemia. 3. Signs and symptoms. Now, what will we see in such a patient? Backhand index pointing right, early signs. Weakness, fatigue. A numbness or tingling in hands or feet. Backhand index pointing right, later signs. Slow or irregular pulse. A muscle paralysis. A nausea, vomiting, abdominal cramps. Backhand index pointing right, cardiac signs, very important. On ECG. For diagnostic tests, we confirm hyperkalemia by serum potassium test. Anything above 5 milliequivalent/L is high. Kidney function tests, BUN and creatinine. ECG, to check for changes. Blood gases. Sometimes there's metabolic acidosis too. 5. Management. Let's discuss management. This is crucial for nurses to act promptly and efficiently. Step 1. Stop the source. Stop any potassium-containing fluids or medications immediately. Inform the doctor at once. Step 2. Stabilize the heart. Give calcium gluconate 10%, 10 milliliters slowly. It doesn't reduce potassium but protects the heart from arrhythmias. Step 3. Shift potassium into cells. The insulin plus dextrose. Insulin pushes potassium into cells. Dextrose prevents hypoglycemia. Nebulized salbutamol Ventolin also helps shift K into cells. A sodium bicarbonate. Used if acidosis is present. Step 4. Remove potassium from the body. Loop diuretics, furosemide. If kidneys are working. A sodium polystyrene sulfonate, Kxalate, binds potassium in the gut. Dialysis, if nothing else works or in renal failure. 6. Nursing responsibilities. Nurses play a key role here. White heavy checkmark, monitor ECG continuously. White heavy checkmark, check lab results regularly. White heavy checkmark, stop potassium-rich medications and fluids. White heavy checkmark, prepare emergency drugs. Calcium gluconate, insulin plus dextrose. White heavy checkmark, maintain hydration. White heavy checkmark, educate patients about avoiding high potassium foods like banana, orange, coconut water, tomato, and potato. 7. Prevention. Prevention is always better than cure. Identify high-risk patients, especially those on chemotherapy or with renal issues. Monitor electrolytes before and after chemotherapy. Give adequate fluids and medications like allopurinol to prevent tumor lysis syndrome. Educate the patient and caregivers about early symptoms. 8. Case example. Let's take an example. A 50-year-old man with lymphoma starts chemotherapy. The next day, he complains of weakness and his ECG shows tall T waves. His potassium is 6.8 milliequivalent/L. What do? Right arrow stop potassium intake, inform the doctor, start ECG monitoring, and prepare emergency medications. This quick action can save his life. 9. Summary. To summarize, hyperkalemia equals high potassium, 5 milliequivalent/L. Common in cancer patients due to tumor lysis, renal failure, and certain drugs. The main danger, cardiac arrhythmia and arrest. Early recognition plus prompt treatment equals saves lives. 10. Closing. So remember, in every cancer patient, especially during chemotherapy, always keep an eye on potassium levels and ECG. Your timely observation and quick action can truly make the difference between life and death.